I sort of changed the title a little bit and called this presentation The Paradox of Healthcare Worker Vaccine Hesitancy. And the reason I did this is because we always, I think, in so many presentations I hear about vaccine hesitancy, one of the things that we say is, well, healthcare workers, they're one of the most trusted source of information about vaccination. So we have to utilize them. And it constitutes one of the core tools to address and respond to low public confidence in vaccination. That's what I hear in almost all meetings that we have about vaccination, which is true. But what do we do when we have healthcare workers that themselves are hesitant and have doubts about vaccine, which is becoming increasingly prevalent around the world? We need to understand what is the nature of their concerns. I think there is definitely space for more work to be done trying to understand what the concerns are, where they're coming from, what influences them. Are they looking at, personal stories? Are they influenced by the patients? Are they influenced by what they read on the media? We need to have a better understanding of this. And this is something that it's starting to grow, but it's still, in my opinion, insufficient. And this is leading to situations where healthcare workers can respond very differently to public hesitancy. And I give one example. Here you see being confrontational, judgmental, critical, thinking that that might help parents and might push them to vaccination, but that is not very effective. And there are other ways that we can see that healthcare workers can respond to hesitancy. And we've seen example in some studies and also personal examples that some healthcare workers decide to delay or adapt vaccination schedule, and I'll come back to that, so they have their own schedule. And this is something that I find as well very common with homeopaths, that they say, well, we're not anti-vaccine, but what we believe is an individual approach. Every child is different, so not every child will need all the same vaccines. If you have a child that's premature, he might need more vaccines than another child, so we're not going to give the same vaccines to everyone. And they sort of play along with the parents' anxiety. And then we also have some doctors that are just straight up refusing to see parents that don't vaccinate their children. And that's not really the right answer either, because in a way you're sort of blocking any type of communication that you could have with them and engagement that you could have with them. So these are all negative ways that healthcare workers respond. Obviously, there's some positive ones as well, but I just wanted to flag them up before I go into the results from my study. So this presentation is mostly summarizing a study we did with ECDC and Franklin here. So what we tried to do, based on all this information, we really tried to understand how healthcare workers feel about vaccination and what their concerns are, not what they think their patients think, but what they actually think about vaccination. So we did a qualitative study in 4 different countries in Europe, and we included different types of healthcare workers. The sort of main strategy was that we wanted to recruit healthcare workers that advise on vaccination. So not only the ones that provide the vaccine once a parent has already made up their mind, but the one that actually give advice. And this is why you can see in Croatia, we had what they're called epidemiologists, because these are types of epidemiologists in Croatia that actually provide advice to parents. But we also had GPs, gynecologists, pediatricians, and internal medicine specialists. So after conducting the interviews, we came up with a few themes that were recurrent throughout the interviews, throughout the 4 countries. So I'll go into detail into all of these, but they were the benefits and risks of vaccination, trust and mistrust, actually, information and communication issues, influences on decision-making, how to respond to patient hesitancy and the role of healthcare workers, and how they think we can improve vaccine confidence. So the benefits. So it's overall very positive to hear that many of the healthcare workers we interviewed actually had a good perception of the benefits of vaccination. And that's what we also need to remind ourselves, that most healthcare workers do vaccinate and are positive towards vaccination. So a lot of them in all 4 countries believe that the benefits of vaccination are higher than the risks. However, they did also say that this balance could change in the future, and they need to keep an eye on the balance-risk ratio and balance. They believe that vaccines are good to prevent dangerous disease, again, all 4 countries, and they often refer to current outbreaks as a proof that when vaccination goes down, outbreaks go up, so that's why it's important to vaccinate. And there's a real sense of disappointment that they shared from deaths that could have been avoided with vaccination. So some doctors mentioned that there was a low risk of side effects, but they did also acknowledge that this is not always what the general public thinks, and that the general public often sees increased risk of side effects. And the concept of herd immunity came up in France and in Romania, and there was a sense of, some doctors described a sense of selfishness of parents, and they believe that parents are selfish to refuse vaccination. And this is a quote from France, where one of the doctors says, well, I consider that those people who refuse vaccination are selfish because they take advantage of the vaccination of other people. Then they also believe that they have a responsibility to prevent disease. That was particularly seen in Croatia, that it's their role as doctors to be there to prevent those diseases through vaccination. And in Romania, we also found that some healthcare workers believe that there's a good scientific evidence for vaccination. So especially if we know that a vaccine is included in a national program immunization, it has to mean that the evidence is there and proving that it's safe and tested. What about risks? Fear of side effects, that's the obvious one. And what we found is that it's not only healthcare workers that talked about their patients' perception of side effects, but healthcare workers themselves shared that they thought there might be some sort of more severe risk or long-term risks. And some of them referred to a ban in other countries. And so if the vaccine has been banned in another country due to side effect, then that's probably that it's not so safe. Or to the media as well, and they referred to media articles that were talking about the safety of vaccines. And that's a quote again, but this is from Romania. That's a bit extreme. It's well known that there are vaccines that have been banned in other countries, anti-hepatitis, precisely because they're proven to cause multiple sclerosis. HPV vaccines can lead to tumors and autism. It's outrageous that they are prescribed. There's also, again, a responsibility feeling from the doctor, but this time it's not so much towards the prevention, but towards the side effects. And there's some doctors, that was in Croatia and Romania, that felt guilty if the patient would have side effects, and it would be their fault in a way because they would have been administering the vaccine. They often mention new vaccines, and HPV came out as a big one in that study. So that was one of the vaccines that was mentioned in Croatia, France, and Romania. Mostly because they believed it had not been tested long enough and we didn't know enough about the side effects and the efficacy. Just this study, I forgot to mention, that was conducted in 2015, so it's been a few years. Children are too young, so for them, a lot of healthcare workers in France and in Greece were mentioning that they receive too many vaccines when they're too young, and sometimes they should decide when they're older and they should be given the right to decide for themselves. For this reason, that was in Greece particularly, the doctors decide to follow their own vaccination plan, and they decide when the children receive so that they don't receive them all at a young age. And here the example of hepatitis B was also very common, in France particularly. There's also the perception that vaccines are not that effective, particularly influenza in this case, so that was the vaccine that they mentioned, and that meant that they would prefer not to recommend those vaccines, and that the vaccine-preventable diseases are not so prevalent, so in the end, vaccines are not so much needed. So I mentioned trust. So there's some positives. So we saw a lot of trust in health authorities from Croatian, French, and Romanian doctors, and they mentioned that they trusted the government, the research, support of vaccination, doctors, WHO, so we saw all of that. But there was a strong mistrust of pharmaceutical companies, and that was in all 4 countries. And their argument was that drugs are being forced into the market, financial interest. The influence of pharmaceutical representatives was also quite prevalent in France as an argument. And there was a sense that they're not being clear enough about side effects, and they're not communicating enough to doctors about the side effects of vaccine. And in some countries, there were some doctors as well who also expressed mistrust of the health authorities, although to a lower extent than what we could have thought. And it was particularly the French High Authority for Health and the Greek government. And the quote here is just from a Greek healthcare worker who says that he did not trust the Greek Ministry of Health, and rightly so, and that many patients do not trust them either. So information and communication, we found some mistrust of the information as well in some countries because of perceived conflict of interest, patients that do not trust the doctors. But for some other doctors, there was a high trust of information. So again, the majority actually trusted the information, but then in some countries there was a bit more mistrust. Some doctors in Greece and Romania mentioned that they did not have enough information, and that was mostly that they wanted to hear more about the safety and the risks of vaccines, but they also thought that patients don't get enough information, and that it's not only the doctors that should get it, but there's not enough communicated to the patients themselves. And one thing that they mentioned, particularly in Romania, is that people turn to the internet because they don't have anything else, and because they just have the vaccine leaflet. So they need to have other sources of information. And then some more positive, again, some doctors in Croatia, France, Romania did mention that they were happy with the leaflet posters or whatever material they had. And yeah. So influences on decision making. So we asked the doctors what they felt influenced how they make decisions about whether or not to recommend vaccination. So there, in the 4 countries, the health authorities played a major role in their decision, and they felt that they were influenced by their employers, whether that's the health authorities or their hospital or different employers, and the National Institute for Health for immunization programs, all the higher authorities. In France, they also mentioned that they felt influenced by pharmaceutical representatives, but they did mention that sometimes this was not always negative, and it could be positive because they would remind them of the vaccination schedule, for example. So that could have been also positive influences. And in Greece, what was interesting is that we found a lot of healthcare workers that admitted that they were actually influenced by their patients. And that's when healthcare workers hear all day long stories about patients that feel scared about vaccines, then it can actually influence their own perceptions. Some had previous experiences, whether negative, so they had a patient that had a side effect, so it made them less likely to recommend vaccine, or positive experiences, so a doctor would have faced a vaccine-preventable diseases, and that would make them more likely to recommend the vaccine. And just other types of influences. So just a quote from this, of the way people can be influenced, that was in Romania, by information, particularly online. So with the increasing popularity of the internet, many parents are misinformed by charlatans and crooks that seduce them with false and absurd information. If some doctors were fooled by such information, parents are very vulnerable to such poisoning. And what I found interesting is that he's actually doing it the other way around, and what he's saying is if some doctors were fooled by such information, then that means that parents can be as well. Well, we tend to see it the other way around. But then how did they feel that they should respond to hesitancy? So here we actually had 3 types of responses. The first one was some believed that it was their role as a healthcare worker to respond to public hesitancy, patient hesitancy. So they believe that they have the information to do it and they should be the one responding to it. Some went a little bit further and said that they should influence the patient's decision. And the reason I'm just doing this as 2 categories is because they actually described tools that were quite strong. So they were saying, for example, I show my patients, I think that's another example, but I'll show my patients a picture of a kid that had polio, and I'll tell them that if they don't get vaccinated, their kid will die. So those type of very strong arguments to try to influence the decision, and sometimes a little bit controversial as well. So here we have a doctor in France that was saying that I say it is mandatory, so that was before France made vaccines mandatory. I say it is mandatory, even if it's not. I don't want to follow a family who do not vaccinate their children. And the last one is what we found in France, that there were many healthcare workers who actually said that they don't believe it's their role. And they don't think that in their position, they should not be the ones to try to influence parents. And they're just there to provide information, and their parents are the one deciding, and that's it. And they're not going to try to convince them to get vaccinated. So some ways that they suggested on improving vaccine confidence in their countries was to improve communication, those same sort of arguments that we find all the time. So trying to improve communication, having more data on vaccine side effects, all of that. In all 4 countries, there were also some demand for stricter legislation, not only in terms of mandatory vaccination, but also defending the physicians and the healthcare workers if side effects occur. And that comes back to the guilt that I was talking about. So discussing fines for parents who do not vaccinate, and also having legal action against anti-vaccination healthcare workers, which is quite a strong statement. And then in Romania, that was the only country as well where they made the link between the vaccination, the vaccine hesitancy, and the health system. And many doctors described the importance of improving the health system because they were describing the problem that how can we recommend vaccination if we don't have the vaccines, if we cannot actually give the vaccine because they're not being available in the country. So they're talking about changes. I think there were also many changes to the calendar. Maybe we'll talk about that tomorrow, but to the vaccination calendar that can also create mistrust. So these were the results from our qualitative study. And just very quickly, we also did a systematic review on healthcare overall populations, but we had a group looking at healthcare workers for HPV vaccination. And these are just some quotes that we found from healthcare workers in Europe, specifically about what they believed, what their concerns were about HPV vaccination. And you find some of the similar arguments that I gave previously. So it's about unknown long-term protection side effect, the patient blame for side effect, that perception the vaccine does not protect against all types of HPV. But what we found as well was, which I think wasn't that obvious in the qualitative study that we did, there was a strong sense of what our opinion is in this case it was a nurse, as a nurse is different from our opinion as a parent. And we can tell you as a nurse to get vaccinated because that's our job, but that doesn't mean that ourselves, personally, we will vaccinate our children because we might have a different opinion. So there's a sort of conflict between what they feel as a healthcare worker and as a parent. And I'll just finish with 4 points that I think would be good for discussion. So first of all, as I mentioned in the beginning, we often talk about the burden of addressing public vaccine hesitancy is placed on healthcare workers. They're the ones who have to address it primarily, with other tools as well. But it's easy to forget that healthcare workers in the end are members of the public. And they're not only healthcare workers in that role, they're also parents. They're also people that have concerns. And they can have the same fears that their patients have. And this can really jeopardize attempts at trying to improve vaccine confidence. Second, I think we're improving in that we're more increasingly listening to patients and to their concerns, but similarly, I think we're not there with healthcare workers, and there's still not enough activities to try to understand what healthcare workers feel. Third, there's a need for more support. And what we'll always find is that healthcare workers complain that they don't have enough time, enough resources to respond to hesitancy, and we need to think about those. And we also need to watch how not to fall in the trap, thinking that all we need is information. That's a trap we often talk about patients, but it's the same for healthcare workers. It's not, we have to look into, do healthcare workers, for example, respond better to scientific information or to more personal stories? As I mentioned again, like they are humans, they are parents, they are normal people, so they might respond better to personal stories. And we need to rebuild trust among healthcare workers. And there are different ways of doing this, but I think one of the core is really engaging them in decision-making, in recommendation policies for vaccination. And finally, if we need, I think, to restore and maintain vaccination as a norm. And I think that's something that we've lost in many cases, and we see it with influenza vaccination, where healthcare workers are not vaccinated. But the will to vaccinate should come from the healthcare workers themselves. Thank you.